Everyone, thank you for joining. Today we have Dr. Nallam for the podcast today. She's taken out her time and we're very thankful for coming today. So Dr. Nallam, why don't you introduce yourself?
Hi everyone, I am Dr. Nallam. I am practicing pediatrics here in California, and today we're going to talk about a little bit about how I'm under pediatric residency, and see if some points are helpful to you.
Sure. Okay. So let's dive into it. Kind of tell us about back in when you started medical school. You were in India, right? You were doing all MBBS in India. Um, Kind of tell us the journey on how you decided, how you ended up coming to America, and was it even a dream for you to come here, or kind of was it fate that it just happened?
It just happened. I
Yeah,
never dreamed to be here or to practice here, to be honest with you.
sure.
So other life choices like personal and my life partner and that actually made me come here.
Okay.
So while I was doing my medical school and before graduation, I'm not preparing to come here in any
Okay.
way. But
Hmm.
once I got married and I know that I'm coming here, that's when I started preparing for my USMLE and started coming about.
Okay. Okay. So how much time did you have? Like, how many months did you have to prepare for that USMLE?
I'm lucky enough to have good time for myself
Okay.
to focus on my USMLEs. I think I have 2 years.
Oh, wow. You had 2 years to study for it.
Yes.
Okay. Okay.
That's,
And
that's because once I applied,
uh,
I applied for internal medicine,
uh,
and I did not apply broadly. That's one of the things. I
okay.
just applied internal medicine,
Uh-huh.
and at the time, I don't have research experience, enough research experience, I should say.
Uh-huh.
So then I did not match the first time, so
Oh,
I
okay.
had
Okay.
to take another year.
Uh-huh.
And during that year, I did some research
Okay.
with another cardiologist,
Oh,
and
wow.
that helped me to get my letter of recommendations, to know the system better, and as a whole, it prepared me better.
Okay.
Also, next time I applied both for pediatrics and internal medicine.
Hmm. Okay. So you got an interest for pediatrics the second time around. Was there a reason you got in pediatrics or just because you
So pediatrics used to scare me
were?
initially. So when I was in my med school and doing my internship back in India, peds used to say scare me because those are little ones, and
Yeah.
it needs a little skill to deal with them and lot
Hmm.
of patience, and also scary,
Hmm.
because they are just so tender.
Yeah. Yeah.
So it used to scare me. However, when I did not match for the first time, I decided that I have to keep my, options more flexible and
Sure.
more open. So I applied both for peds and internal medicine, and I think I applied for a few programs in psychiatry too,
Oh,
because
wow.
those are the less competitive at the time. But
Okay.
it is very competitive these days.
Wow. 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 So kind of rewinding back on all that, that's a lot to unpack. I know a lot of foreign medical graduates, IMGs, they all want to come into America and they're like, how do I get like observerships? How do I even study for my USMLE? How do I match on the first time? In terms of all those things, like first off, on your USMLEs, was there something specific that helped you learn the content? Especially coming from an Indian curriculum background, or was there, what did you just go with the first aid and typical resources from America?
See, at the time, I was preparing for USMLE back in 2011, so
Okay.
it's a few years.
Hmm.
But at the time, we used to do Kaplan videos,
Kaplan. Okay.
and it really helped me a lot. Like because when I was doing my USMLEs, I had more time to focus on my studies.
Sure.
So it really helped me with my basics and like physiology, anatomy, those basics. So Kaplan videos. First aid is like really during the last 1 month of the
Okay.
exam. You and but Kaplan videos, and we used to do something called some questions, I think.
Oh, question bank.
Yeah.
Okay.
Yeah.
Okay. So Kaplan was the one that helped you relearn the information that you had learned back in medical school.
Yeah, the medicine part is always the same. It's just, how you put them into perspective.
Of course, yes. So did you take step one, two, and three all in like a short period of time, or did you like space them out? How was that done?
So step one is the one that took me longest because it has a lot more, information.
Sure.
And it didn't take me much for my step two and step three. Step two, I took 4 months, and then step three is kind of another 4 or 5 months.
Okay.
Uh, yeah.
And you did all of those before the time you matched, right?
Yes, I'm done
Okay.
with step three by the time I applied.
Okay. And then in terms of you said when you started doing research with the cardiologist, was that also during a study period?
I, yes, half of it. I did research for almost 1 year to 11 months.
Oh wow.
And
Okay.
during the first half, I did my exams, and then the second half, I didn't have to do.
Oh nice. Okay. Okay. Um, I personally get these questions a lot. People are always asking, how do I get research? How do I ask people for research? Is there something that you did to get research with a cardiologist? Do you have tips for anyone who is looking for a similar type of situation?
Yes, definitely. See, when I came to the United States with my husband,
Hmm.
at the time, I don't have many contacts. I don't have no contacts, I should say. Maybe one doctor in family medicine who's like a distant relative. But
Uh-huh.
otherwise, I don't have many contacts. None. So what I did is I used to go to hospital websites
Hmm.
near my house, like Google them,
Uh-huh.
and I used to look at what research programs is going on in those places,
Okay.
and we used to see if there is any contact for doctors or like the program, email addresses for like the research programs and stuff like
Sure.
that. I used to send emails asking for opportunities.
Wow.
And one of the observership I got
Uh,
is to a doctor who responded that
wow.
he put me. Yes. Uh, I have no, I don't know
No
I don't
connection.
know the person before
Uh-huh.
email. And he responded and he said, I can help you with an observership. And he helped me with an observership in a hospital. It's a
Wow.
community, like a small hospital where I lived at the time.
Uh-huh.
The research, though, I think, at the time, all the students who would come would stay in like a small circle with contacts, and with the social media nowadays, it's much more easy. Uh,
Hmm.
so the that research coordinator or the research person has been referred to me from my colleagues who went through the process before me.
Oh wow. Okay. So this is you're kind of living proof of just email everyone you see and then you hope to get one or two responses back. So, okay, so you advise people kind of in the same situation, just go online, email everyone and see
Yes.
what happens.
Yes,
Okay.
yes. If you think about it, we get so many emails,
Uh-huh.
and getting an email from a student is always shows good on the student because they
That's
are trying, they are proactive, and in no way, it's taken as a disturbance or like anything like that.
sure,
No,
sure.
feel free to reach out email because it just tells that you are trying hard.
Hmm. That's true. Okay. Okay. That makes sense. I think a lot of people get scared. They're like, I don't know what to do. How do I reach out to people? But I think that's a good point. Um, on that topic, kind of a more technical question. I know you came in with a spouse, but in terms of like a visa situation, let's say someone from India, Pakistan, surrounding areas, they want to come in, they get a research opportunity by emailing. How would that situation work? Do you have any insight on that for those people?
For the visas,
Yes.
so I think at the time I was on H4, like a dependent visa.
Okay.
It's like a research volunteer. So I
Okay.
didn't get paid during that period
Oh, okay. Okay.
because on H4 you cannot work.
Yeah.
It's I just did the research as like a volunteer research assistant, and
Right.
we didn't get paid during that period. And it's a learning opportunity, and it's an opportunity to get into the system and all of that. So that's a bigger pay in itself.
Yeah, yeah, no, that is.
So yeah, so on H1 you don't work.
Okay.
Yeah.
Interesting.
And
That
then
that's a good way. Mhm.
most of the students also come on B1, B2, like the visitor visa, to do their exams and stuff. I guess you can do the research assistant opportunities and those jobs as a B1, B2 volunteer. You don't get paid.
Oh
So
wow.
for to be paid, you need the H1 or J1 visas.
J1s. Okay, okay. That's a smart way. I've never thought that you can do these research without getting paid because normally people are always like, oh, I need to get the visa that I can work for. But
Mm.
if that's a good way to, maybe I'll tell that more to people who ask.
Mm.
Um, kind of diving a little bit more in. So you did your research, you applied for the match, but coming from the Indian schooling system and then coming to apply an American residency, was it difficult for you to write the personal statements? Was that a difficult challenge? Because in my experience, I've noticed that the people from the different curriculums, they don't know how to write personal statements the way the American system is. Was that a difficulty for you at all?
I mean, it wasn't difficult, but I think I took the help of my research doctor, the doctor
Okay,
who I was working with at the time. So I did my personal statement, and then I asked him to help me if he would have any suggestions for me at the
sure.
time. And he did give me some tips on like how to make it more presentable and that sounding in then he would tell me like you might want to remove this or like because it just tells the same thing as it is in your resume and all that.
Mhm. Okay, okay. So you got some good tips from that. That's good. That's good. And then, so you matched after doing all of that. You got your letter of recommendation, and then you did your residency. Any insights into residency? Was that something new, or was it kind of similar to your internship back in India?
So back in India when we were doing the internship we would have a lot of responsibility
Okay,
and do so many things. We would just deliver babies, we would do lacerations, we would do so many things. I mean,
hmm,
obviously it's a different system, but
sure.
here there is a lot of like medical legal issues and stuff like that.
Mm.
For me, that is the biggest difference. Like
Okay.
how medical legally like things are so different here, how people would think about like,
Hmm.
um, medical legal aspect of medicine all the time, different
Hmm.
say. So that was, but the medicine part of it, the human physiology, the pathology, the anatomy, it
It's all
doesn't.
the same. Yeah.
Your knowledge is your knowledge. That is your power, right? It
Yes.
doesn't change. Your assessment, your diagnosis, it all depends on your medical knowledge. It doesn't change.
Hmm.
And the way you approach is a little different. It's just because how we the diagnosis is different and the resources are different and stuff like that, but it doesn't take much for any person to learn that. As long as you have your medical knowledge, you do your exams, you're passing your exams, be very confident, you're more than prepared, and it's just like it just takes like a month or two, and then you know your way around, and
Okay.
is not
It's not that different overall.
it's
Okay.
not
Okay.
difficult.
Got it. Got it. And then kind of your personal story. So you completed residency. Did you do anything after your pediatric residency, or was it straight into working?
I went straight into work.
Straight into work. Okay.
Priorities change as we grow.
Hmm.
And I wanted to, initially when I was applying for residency, when I don't have my kids, I was like, oh, I want to do a fellowship, I want to do this, I want to do this. But then once I had my first child in my second year of residency,
Oh
I
wow.
missed him so much. I would just come home and, after my night shifts or like, then I would just sleep beside him and I would look at his face and I'm like, does he even realize that I'm his mother?
Um,
That's the kind of thing. I would just miss him
uh,
so much.
uh,
And so then I'm like, I'm done with residency. I just want to start my family, raise my kids. And
uh,
I work in a patient pediatrics office, which is 9 to 5 kind of office hours, so I can be there for my kids at home, have a lot of work-life balance.
Good, good. Congratulations to you as well. You have a great life. You've been through a lot, the big long journey, and now you're reaping the rewards of your hard work. It's great. It's great to hear. Thank you, Dr. Nallam. I think this was great, very informative. A lot of the audience that watches this are also aspirational American residents. So we hope they all make it here to America, get their residency, and with your guidance right now, I think this is great and really informative for them. So thank you for taking the time to come on.
Thank you for having me. It's my pleasure.
Thank you.